In other news today, more than 3,000 cancer patients say they've been impacted by the Gauteng Health Department's oncology funding setbacks. This week, lobby groups presented a memorandum to the department. They want officials to spend the 784 million rand set aside by the Gauteng Treasury in March last year. The money was meant to outsource radiation services. Newzroom Afrika's Karinda Jagmohan spoke to a single mother in Orlando West who describes her frustration to access treatment for breast cancer.
We are here with Tato Moncho. She was diagnosed with breast cancer in September 2020, but 4 years later, she's yet to receive that life-saving radiation treatment. She's gone through various stages of painful chemotherapy, but still right now, some of the cancer has spread to her lungs, and she needs that urgent radiation. We've been having a long discussion about the state of cancer treatment in South Africa, specifically here in Gauteng, and Tato joins me now. And you can see she's also a fitness instructor. And Tato, I believe that your passion for fitness also is what's helping you go forward. But tell me about the state of your treatment today compared to what you expected 4 years ago.
I never knew that I'll be waiting this long for treatment, Yes, when it comes to chemo, you do get it, but I never realized that when it comes to radiation, it's going to take me 4 years waiting for radiation. Hence, my cancer managed to spread to both my left and right breast and also into my lungs. That's what stopped me from running actually for the past 4 years.
Tato, you're also a mom to a teenager today. You're a contract employee. Tell me about the struggle just to try and reach out to Gauteng hospitals to get that radiation treatment and being told you're always on a backlog.
It's frustrating actually because you never know where your cancer is going to move into your organs. And the only thing that I pray and fight so hard is that I need to see my daughter grow. I cannot die and leave my daughter behind as I'm the breadwinner only at home. And my mother is a pensioner. She is 75. My daughter is 15. So I'm the only one who needs to take care of them. So what happens to them if I die? While the Department of Health is refusing to give me the simple treatment. And yet, Treasury gave them 784 million actually, to use for cancer treatment. What's stopping them from using that money? What's stopping them from giving us treatment? Why are they so selfish when it comes to our treatment, to what we need? Because that's the basic health care that we need as South Africans. If I was working permanently or somewhere where I could afford a medical aid, I would have been there. But I can't go there because I don't afford a medical aid. The only thing that I depend to is the Department of Health, the government health system, to help us with radiation. That's all.
Tato, thank you so much for bearing your soul with us. We really appreciate it. Tato Moncho, who is a fitness instructor. She is currently facing stage 3 cancer. She has a teenage daughter and she urgently needs radiation. The isolation for cancer patients is terrifying. Your own white blood cells are attacking your own immune system and you need treatment for this. Chemotherapy is extremely painful with those chemicals running through your veins. Radiation is one of the best options for certain cancer patients, many cancer patients, but those who rely on the public healthcare system are battling to get this treatment, like Tato, who now needs radiation before the cancer further spreads. It already has spread from her breast to her lungs, and she fears the further spread of this. The Gauteng Health Department spokesperson has declined an interview with Newzroom Afrika, referring only to a statement sent out after the memorandum of demands were delivered by patients. We've read out some of their responses, but the patients need urgent assistance, more than 3,000 across this province.